By the time an obese patient is asked about bariatric surgery, you know well that they have had a long battle, often since childhood, with trying every other weight reduction solution. For most patients, diet and exercise are simply not sufficient to produce the sustainable weight reductions needed to reverse the effects of obesity. Obesity is not synonymous with laziness. Patients do not lack willpower or common sense. They are facing a powerful addiction with ties to mental health issues and issues of self. Bariatric surgery is not just about personal needs nor personal wants, but is a matter of necessity. Unfortunately, social stereotypes are widespread, even amongst healthcare providers. Patients seeking help need doctors and support staff who can explain that bariatric surgery is a viable and long-lasting solution and is a critical part of the team approach of the obesity management strategy. For the right patient, bariatric surgery is an extremely effective tool that completely treats hypertension, sleep apnea, and diabetes, plus many other comorbidities. By addressing obesity with bariatric surgery, these diseases have the potential to be eradicated. But it is not an easy way out. There is intense and significant effort that must be taken on the part of the patient for life after surgery. It is not a magic bullet. It is a lifelong commitment that patients make with their medical team supporting their obesity management. The vast majority of weight reduction programs offer only short-term results of at best 5 to 10% absolute weight reduction, whereas bariatric surgery, which can produce on average 30 to 40% absolute weight reduction and has long-lasting, important benefits for the right patient. Currently, the 3 primary bariatric surgeries performed within Alberta Health Services are now done laparoscopically. The adjustable gastric band procedure is technically relatively simple and straightforward and could be reversed by removing the band later in life if necessary, since anatomy is not altered. However, it may not have as great an impact on weight loss as the other procedures. Sleeve gastrectomy is less complex than a gastric bypass and takes only 90 minutes to perform. It is a restrictive operation and also suppresses appetite hormones. However, it is not reversible because a large portion of the stomach is removed. As well, the surgery is relatively new, having been performed for 6 to 8 years, so long-term effects are relatively unknown. Gastric bypass has been done routinely for over 50 years, nearly 20 years laparoscopically, and is the most effective surgery for losing weight and optimizing health status. It is a more complex surgery, taking up to 2.5 hours, with more potential for early complications such as infection or anastomotic leakage. It is not reversible and can cause vitamin deficiencies over the long term if supplements are not taken. Beyond these 3 common procedures, a revision surgery clinic has now been established as part of Alberta's bariatric program to assess patients who have had a previous bariatric procedure that is now failing and may require further complex surgery to revise. It is important to identify which patients are best suited to bariatric surgery because bariatric surgery is not for everyone. It is not for those with severe medical illness, such as mental illness, drug or alcohol problems, cirrhosis, HIV, hepatitis C, among others. It is not for active smokers or patients over 65 years, because anastomotic leakage rates are so much higher in such patients. Alberta's bariatric program is prepared and funded to grow. We have improved and simplified the referral system so patients are effectively screened and referred on first inquiry. We begin the process by preparing each patient both physically and emotionally well in advance of their surgery. We can help your obese patients with bariatric surgery as part of the obesity management strategy. With bariatric surgery, there are very real opportunities for health outcome improvements.